Hello everyone and welcome again to another episode of the My Health, My Way podcast powered by MYWAY, where we make health conversations more accessible and fun. We are your amazing hosts. I am Fini Ndegwa.
My name is Jishukuria.
And I am Dr. Samira.
Today, we are joined by a very, very special guest, an expert in a field, I might say.
That's true, baby. Come on.
She is Dr. Hilda Nabiswa, who is a specialist diabetologist.
Yes.
Am I right?
Yeah.
Doctor, I didn't butcher it. Diabetologist. I hope I said that right. She is an expert in her field. She is
Gorgeous.
thank you.
Yeah.
She has a lot of information and we are so happy to be here with her today. Karibu sana daktari. We're so happy to have you here.
Thank you.
How do you feel?
Well, I'm happy to be here. Your office is very pretty.
Thank you. Even us.
Yeah, just as much as you guys.
So I just want you to tell us a little bit about yourself as daktari.
Okay, so I am a diabetologist. I work at Kenyatta National Hospital, and I also have private practice in Nairobi at Upper Hill Medical Center. I have specialized in diabetes, but I also do a lot of diabetes reversal or remission, which I'm sure we're going to talk about today.
For sure.
I do a lot of lifestyle coaching for people who have diabetes, because as you know, diabetes is a lifestyle disease.
Yes.
Yeah, and actually, I think that's about it. I don't think there's much else.
That's a lot in itself.
Really?
The fact that you're doing so much in that field is amazing. I'm really curious to know how you got into it.
That's interesting. So, I actually was born with insulin resistance. Let me put it this way.
Okay.
I have a condition called polycystic ovarian syndrome. Do you know PCOS?
Yes.
So PCOS makes me inherently insulin resistant, which means I'm at a higher risk of getting diabetes.
Really?
I even got pre-diabetes at some point.
What?
Yes.
We actually can dive into that at some point.
Yeah, so I have walked that journey. I know how difficult, when I tell a patient go and exercise, it's not, I know, it's hard.
You've lived it,
Yeah, so that's one of the reasons. And then my grandfather has diabetes and I've been taking care of him. So when I became a physician, that was just something I just naturally fell into.
Yeah.
I love that.
I love when I hear doctors with lived experiences of what it is they're working in, because there's not only passion in it, there's also an understanding of the patient.
It's literally
aspect of it.
personalized.
Yeah. So when you're talking to me as your patient, you're not just speaking to me from a doctor's perspective, but also understanding my lived experience with what
I'm more
we're talking
empathetic.
about.
Exactly.
Yeah.
And
Love
you'd be
that.
relatable. So for me as a patient, if I know your story, then I would feel comfortable and confident to actually have you as my specialist. That is lovely.
Thank you.
So, what is diabetes? To be quite frank, everybody knows about diabetes, but what exactly is diabetes? Yes, there are various types and stuff, but we'll get into what is diabetes.
That's a good question.
Yeah.
And I get asked that a lot by patients who have already had diabetes for a while. They still don't know what diabetes is because they are just told, uko na sukari. Okay. So the first thought is I need to stop everything with sugar. Then they start blaming themselves for taking too much sugar in the
Warus.
No, all that Fanta orange and Coca-Cola.
Exactly. Yeah. So diabetes is generally just sweet. Basically, it comes from a Latin word which says sweet urine. So how diabetes was first diagnosed?
You are today years old.
It was diagnosed through, so they realized that there are some people who, when they urinated, it attracted ants to the urine.
That's
how diabetes was diagnosed at first. They were like, kojo hapo. And then they're like,
what?
Yeah. So basically, when you have higher sugar than normal, which is what diabetes is, anything that gives you higher sugar than normal in your blood stream. So when that happens, then the kidney is overwhelmed with the high sugar levels and it tries to help out. So that extra sugar leaks through the urine. So that's how the sweet urine came about. But basically it's just high sugar levels. And then that means that there's a normal, right?
Yes.
For it to be higher. So the normal is that anything above 7 when you have not eaten
Okay.
So normal is 4 to 7.
Okay.
Anything above 7 is diabetes.
Okay.
And then when you have eaten, it should be up to 11.
Yeah.
So anything above 11.1 is diabetes.
When you've eaten.
When you have eaten, if you have symptoms and you have sugar levels above 11.1, that is diabetes. And then there's also another test we do that checks your sugar for the last 3 months, which anyone above the age of 35 should get.
Have you heard,
millennials.
guys?
I've
Millennials.
just arrived at this 35.
I
Diabetes have been thrown at me.
Here we have a guinea pig.
Gosh.
You must go.
So
You
I'm
must
talking
go.
to you millennials. I know we have been thinking we are young for the, hey, by the way.
So this is the year.
This is the year.
I even
You
have
need
a
to
few
go.
I'm going to push. Thank you.
Yeah, push them.
I see you.
So if you're 35 and above, you have to do a test called the HbA1c. And that one looks at your sugar for the last 3 months. HbA1c. So it looks at how much. So your red blood cells last in the body for 90 days.
Okay.
So if it produces you a leo 3 months, then it dies.
Okay.
So the amount of sugar it was exposed to is what this test looks at. So it looks at your sugar for the last 3 months based on your red blood cells.
Oh my word. So I need to get that done like yesterday.
Yeah.
It's part of the annual check we're talking about.
Yeah, actually,
Annual
yeah.
checkup.
Yeah, because it's my 35th year. So when you get to 35 and above, it's something you need to
Just
do
do regularly. Hakuna tena cha kusema eti, oh, and it doesn't matter. There's some people who think it is skinny people don't need. It doesn't matter.
Right, everybody.
Above 35.
Damn. Damn. I feel attacked.
And also, so now, as you are talking about even like this, the tests for diabetes, what is the test for diabetes? How do you test for it? Because I'm sure there are people who are watching who don't even know how to get the test done.
100%.
Is it a blood test? Is it a urine test? Yeah.
Yeah. So thankfully now you don't need ants to come and smell your sugar. And
But you
doctors don't have to taste. Oh, by the way, I forgot.
They
that
used to
part.
taste.
We used to taste urine.
No, please.
Sugar, you're like,
I am mortified.
I would,
Yeah.
You wouldn't have
It's
never.
called
please.
dedication.
No.
Hippocratic oath. You swear to take care of your patient.
Yeah.
Includes tasting.
You lost me
No.
at tasting urine.
They would just
They'll be like,
Ini tamu.
attach salted caramel.
Oh, guys.
Attach citrusy. That's all.
Anyway,
Wild.
so to do the test, it's very simple. Random blood sugar, just a prick. And that can be done at any chemist, but it's so easy to. Any health center, any chemist, it doesn't matter how go, you know, anywhere,
get it done.
you will get a blood sugar done somewhere. And it's only 100 shillings.
Oh,
so
thank
there's
you.
no excuse.
I thought it was expensive.
No, it's just 100 bob. And in
okay.
fact, if you get a very good place, even 50 bob, they'll do for you.
Oh, wow.
Okay.
So if you go when you have not eaten in the morning, your sugar should be between 4
To 7.
and 7. Although we'll talk about pre-diabetes. There's also pre-diabetes in the
Yes.
mix.
Okay.
But for it to not be diabetes, it should be less than 7. And then if you have eaten, it should be less than 11. So that's the
That's how
prick.
you gauge.
But then there's something called HbA1c. That one I've said about the 3 months.
Yes.
That one costs roughly 1,500 to 2,000 depending on where you
go.
get it
Yeah.
done.
Yeah.
And then it checks your sugar for the last 3 months, but it's a blood sample. Although we have small point of care machines. I even have one in my office where I do it with a prick and I'm able to still check.
The rapid.
Yeah, the rapid,
HbA1c.
yes,
Yeah.
yes.
So interesting.
Yeah.
Okay.
And are there different types of diabetes?
Yeah, there are. So, like I said, anything that makes your sugar go above that is diabetes. But then now the question is, what has brought it? Huh?
Yeah.
So type 1 diabetes is where you don't have enough insulin in your system to bring down the sugar.
Okay.
So I look at it this way. Insulin is like an ATM card. So you need an ATM
You
card.
have them interested.
Monday. Tell me more.
Is that debit card?
It has to be debit.
Is that a black
It's money
card?
that's already there.
It's there. It exists. Okay.
So it doesn't matter how much money you have in your bank account. If your ATM gets jammed, you will get there with 0, right? So the ATM card is the one that gives you access to the money. So what insulin does is that it opens up, it becomes the ATM card that allows the sugar to get into the cell. So it opens that pathway for the sugar to come from outside into the cell. And then there it's used for energy, you know. Like the brain, for example, uses only sugar. It doesn't use any other form of energy.
Wow, the brain is my friend.
Oh, is that why when you're maybe hungry or
unaanza
something,
kus-
I wanna
yeah,
shut down?
yes.
It's like,
So
oh, I
all
can't
the-
hear
also-
anything.
But also all the silly decisions I make, I can blame them on sugar. What are you talking about? Guys, think about the diversity of this.
You tell your brain,
I'm
you
saying,
love
yeah.
what I love.
It's like, I need a cake.
I'm here with you.
I'm here with you.
It's your fault.
It was just the sugar. It was the sugar.
Yeah, so
Okay.
yes, so the insulin makes sure that the sugar gets into the cell. It can either get into the cell and be used as energy or get into the cell and get stored as fat. That's why when you take too much sugar,
It's converted and
into fat.
yeah.
Because that's potential energy. Yeah, then it goes
stored.
to become active energy. Yeah. So the main types of diabetes now depend on that process.
Okay.
So the first one is type 1.
Yeah.
Type 1, the problem is that there's no insulin.
So your
There's
body is
just no
not
insulin.
generating
So the
that.
body is not able to even get that sugar from outside into the cell.
Which is produced by
By
The
the
pancreas.
pancreas.
So the pancreas's job is to bring down the
Dr.
sugar.
Mdogo.
Please,
Daktari,
shule,
very nice.
nilisikiza shule, guys. I was
What time did you sleep
attentive.
last night?
Pancreas, diabetes.
So most of the time it happens in small children. And actually the reason why the insulin was produced was for type 1 diabetes small children. If you go and get Bunting and Best, they're the people who discovered insulin. And then look at the before and after of those kids. Zamani it was you get insulin, death sentence. Like, wewe tunakupatia 4 years, wewe 5. So kids were dying because of no insulin.
Yeah.
So when that's why the patent was sold for $1, because it was literally a life-saving thing.
for children.
For children. So it makes a big difference. When you don't have insulin, you lose so much weight because the insulin is what makes that sugar get into the cell to convert into fat.
Yes.
But then, and it uses up the energy. But now what happens is if you don't have that capacity for the glucose to get into the cell has to look for alternative ways of getting energy.
Yes.
So it eats up your fat, it eats up
Yes.
your muscle, it eats up anything.
Yeah.
So you just end up becoming so skinny.
Yeah.
Yeah, so that's type 1 diabetes.
Okay.
However, some people with type 2 diabetes end up getting type 1 diabetes, but I'll discuss that later.
Okay.
So that's type 1. Type 2 is insulin resistance, which is now what is happening in the world.
Yeah.
What is happening is that waistlines are getting bigger.
Yes.
So you know these things.
Yeah. Waist are not
Tunakula
snatched
vibaya, we are
Ni
not
kweli.
exercising, working from home,
Yeah.
what a
Yeah.
COVID time.
Sedentary
Yeah,
lifestyle.
COVID
Sedentary
time.
lifestyle. So what happens is, because of that, you have so much fat. Now, there are things that make the body resistant to insulin. So ATM in a jam. You have the card,
But you can't get the
you
money.
can't get access to
transaction.
the money.
Yeah.
So the reason is fat. So fat actually directly causes insulin to not work properly. It just in a
Become a
cause
block.
resistance. In a block too. In a block. So because of that insulin resistance, the pancreas has to work extra hard
Yeah.
to make sure there's so much insulin, like 1,000 times more,
Right.
Than it needs.
so that at least 5% of it can work.
Yeah.
So it overworks the pancreas, and that's what now happens until some people with type 2 end up getting type 1. That's why you see some older people on insulin jabs.
Yes.
Because what happens, the pancreas gave up. It was
Yes.
like, I've been
But
working.
they
You're not
I'm
even
out,
using
I'm
this.
out.
I'm out.
Si lazima
Yes,
tu-
exactly.
exactly. It's been working and overworking for years.
Like our
Gives up.
doctors.
Light shade. Light shade.
Yeah, 24 hours on
Paid.
call.
Yeah, one of
Well
them
deserved.
paid.
Well
And they want to
deserved.
be
Well deserved
paid.
call out.
Yes.
Gava.
Yeah.
Watch this episode. So
Yeah.
actually, so now you
So
talked
type
about
one?
the two types.
Type
and
1,
then-
type 2. Now there's
mentioned
gestational.
pre-diabetes.
You know, there are some people who get diabetes because of pregnancy.
Let me tell you something about pregnancy. Every time someone
Child,
tells
have
me
you
a
seen
new
the
thing,
girl with the list? Have you seen the girl with the list? Please,
every time
Mimi.
someone tells
Good
me
night.
anything, and I'm like,
There's a list.
Who has a long list
Oh,
of why
what?
you should not get pregnant.
Pregnant. It's reached probably 100 and
Loss of
something,
teeth.
200.
More than.
Loss of teeth, more than.
with my
of
eyebrows.
teeth.
Loss of
She lost her
teeth.
entire teeth.
Your
Your
uterus can
teeth.
fall out and diabetes.
Now there's diabetes.
Child.
Girl with the list. This is for you, sweetie. I don't know. What do you mean you can get gestational
So
diabetes?
the placenta, remember the placenta is a foreign thing. It's not
Object,
your
yeah.
part of your body. That's why it gets out with the baby.
Right.
Yeah.
So the placenta has some hormones that directly, again, cause insulin resistance. They just block. They're like, not working today. Yeah, so because of that, someone gets diabetes. And many times, it now progresses into type 2
Is there
diabetes.
a cause? Is there
There are very many causes starting from perinatal, from when that person, that mother, was in, not conceives, was in their mother's womb.
Everyone leave women alone. Leave us alone.
So that plus what you take, women should be very careful about what they take during pregnancy, because if you gain a lot of weight during pregnancy, not only are you at risk of gestational diabetes, you're putting your baby at risk of gestational diabetes when they're an adult. So think about your future generations.
Grandchild.
Your grandchild.
I was an overweight baby. Well, so there goes my...
There goes
your sign.
So be very careful about how much weight is gained. And this maneno ya sijui kukunywa uji ya njahe sijui vitu gani.
Yeah, ukinyonyesha.
Yeah, then people gain so much weight after pregnancy instead of losing that baby fat. So we should be more careful about weight gained during the pregnancy and post-pregnancy period, because that directly causes type 2 diabetes as well.
That's really
And then now there's other types of diabetes. There's actually one caused by malnutrition. Yeah, so if you're not able to eat properly, the pancreas also struggles, then doesn't produce enough insulin, then diabetes. There's another one caused by drugs like steroids. Time for COVID is when there was a lot of diabetes because everyone was using dexamethasone and prednisone. Those are steroids. Steroids directly cause diabetes as well.
And now, wow, this is, and then there's also now the pre-diabetes you spoke
now
about.
Pre-diabetes, yes. Now pre-diabetes means you're just about to get diabetes. So HbA1c, remember I told you about HbA1c. For diabetes, it's anything above 6.5%.
That's when the red blood cells...
for 3 months.
For 3 months,
yes.
okay.
So if it's 6.5% and above, that's diabetes. But if it's 5.7% to 6.4%, that's pre-diabetes. So you don't have diabetes, but you're on the way there.
The journey.
So, and that's the best time. Let me tell you, you guys, that's why I'm talking to all of us. Because if you do regular tests, the best time to get to know about your status is before you actually get diabetes. So that you make those changes at the pre-diabetic level. You don't wait
to contract.
Maziwa ishamwagika.
Yeah.
So that would be a great time to also ask you then, what are the ideal levels? You said 7 and 11. So 7 for the starving, I'm guessing.
Yes,
and then 11 for the
random.
So what would be the ideal number you should be expecting to see so that you're not looking at pre-diabetes, or neither are you looking at
less than 6.1.
Got you. Yes. That is now for the starving.
For starving. For random, we usually don't have a figure.
As long
but
as it's not
fasting should be less than 6. So 6 and below.
Hey, I'm doing nothing today.
You're doing it.
Nobody, no. Oh, let's not stop
Ask you tomorrow, kindly.
Yeah. And the problem with diabetes and high blood pressure is that they are silent diseases.
Yes.
Yeah.
You know, I've literally diagnosed someone with diabetes when they're coming for dialysis. That's when they know. Oh, or when they're coming for an amputation.
Oh my goodness.
Yeah. So people just don't know, especially in places where the information doesn't get there. And that's why if you know you can access this information, still go back, talk to your grandparents, talk to your uncles and your aunties, because sometimes they just don't know.
Yeah.
We assume because all this information is everywhere that everyone knows, but
It's true.
Show them
not.
this video,
I think
guys.
also, what symptoms should they watch out for? Especially
Yes.
if I'm a new mom and I've just gotten my baby, how do I make sure I'm watching out for type 1 diabetes, especially if it's running in the family? And then also as an adult, I'm not over 35, but for the over 35.
Let's start
with
from birth. Let's follow this person from the beginning till...
Yes.
So at birth, if you have a high birth weight, anything above 4 kgs, spoils a lot also.
I'm being
Please, were you that person?
You are how many kgs?
I think 4.
And she said skinny people are not...
No, I wasn't skinny.
No, now you're skinny.
Oh, yeah. Well...
So she said even you have to check.
But it's okay. Don't worry. Just as long as you do the regular testing, it's fine.
Yeah.
But anytime a mother gives birth to a big child, the mother should test for diabetes because it means there's something that happened during pregnancy that supplied too much energy to the baby, which was converted into fat. So diabetes is the #1 culprit. So always big babies, test the mother.
Yeah.
Then now this baby starts growing up, and then they start losing weight. They start getting infections, can be urinary infections, or now I'm following this child who's getting type 1 diabetes.
Yes.
So what to look out for? So any baby who loses weight despite eating a lot, urinates all the time. Like literally all the time.
I thought it was a myth. My mom used to tell me that. So now to hear that urinating frequently is a symptom.
It's a big symptom. So urinating a lot despite eating, and they're eating all the time, but they're not gaining weight at all. In fact, they're losing weight. Recurrent infections, especially genital. Because like we said, the urine was sweet. So it attracts bacteria and fungus. And that in the end causes infection. And then many times they actually get a very life-threatening complication called diabetic ketoacidosis, DKA.
Okay.
So now that is a life-threatening disease which is caused by lack of insulin. So what happens, remember I said insulin, kazi yake ni kuleta glucose into the cell. Now there's no insulin, so the body has had to rely on other forms of energy here and there. The problem is those forms of energy, the reason why the body does not start with those first usually is because they have byproducts.
They're not
the
filtered.
byproducts are called ketones. They are acidity. They are not filtered.
Hey,
I love it, sweetie.
So these ketone bodies are very dangerous to the body. They cause acidity levels to rise, and the whole body becomes acidic. Then the baby starts, you know, PCOS?
Yes.
So PCOS makes me inherently insulin resistant, which means I'm at a higher risk of getting diabetes. I even got pre-diabetes at some point. Yes.
We actually can relate to that.
Yeah, so I have walked that journey. I know how difficult, when I tell a patient go and exercise, it's not, go and exercise. I know, it's hard, you know. Yeah, so that's one of the reasons. And then my grandfather has
acidity, basic.
So when I became a physician,
guys, I'm shiny. Let me tell you, in another life, ningekuwa daktari. Nili failed chemistry. I failed chemistry. Otherwise, guys.
I love it, sweetie.
So the body keeps a very tight control of the pH. It should be between 7.35 and 7.45, and that's it. It should never, like, nobody walking around has a pH that, when they are normal, has nini. But then when you have decay, it goes down to as low as 6.9, 6.8, and those figures are literally almost incompatible with life. So all the organs shut down. The liver, everything just shuts down. So it's very dangerous. So if a mother starts noticing these symptoms, just, first of all, before the baby gets to DKA, make sure you've done a blood sugar test. But if they get to DKA, it's not over. The good thing is that as much as it kills, it is one of the best acidosis to have, because it also, as long as you give someone insulin, shoop, wanarudi back to normal within a day. You wouldn't even believe the person who was almost dying jana is the one looking at you. So the recovery is so quick. So anyone who assumes or thinks that their child has DKA, please rush to the nearest hospital and let them get insulin and fluids, and they will do well.
They'll bounce back.
Yeah, they'll bounce back.
That is...
So now that's type 1.
No, this
They
has
have grown. And remember, there's schooling. Can you imagine having a child who needs to go to school, get their injections? You have to talk to the teachers to know when the sugar is low, what to do. It's very tricky. Being a parent of a type 1 diabetes patient is really, I think the only thing I can compare it with almost is a sickler. Those two, sickle cell and type 1 diabetes is really, being a parent of that is, I salute all the parents out there. It's not easy.
On that journey.
It's not easy.
Yeah, we had a chat with some of them, and like now they're forming like organizations, like communities where another parent can tell the other parent, don't worry, you're not alone in this journey. You know, we can do this together. They even have like, they know where to access the access programs where they can get like the free glucometers and all this thing. And then now they have to have the number of the matron in charge of their child, so that they can always check in the morning. So imagine that parent is just there waiting for the sugar levels for that morning, because they're just so scared of decay.
That's true.
They're going through a lot.
They're going through
type
a lot.
1 are really soldiers.
It's very difficult. At this point, let me also talk about a support group for type 1 called Young and Sweet. You've heard of it?
No.
Yeah, you need to invite them over. These are people who have type 1 diabetes, and they're now in their 20s. But they've been through the most. Remember, they've been teenagers with diabetes, going through adolescence with diabetes, and they've gone through everything. They've gotten DKA, gotten admitted in hospital, but now they've come out and they want to support younger people with diabetes.
Wow.
So you should invite them.
That is
Young and Sweet.
Young and
And
Sweet.
sweet, like
Yani
and
wanatoa hiyo
sweet and
sweetness.
the
Oh, wao si watamu.
Hawataki kwa watamu.
Yani, we are not sweet.
Exactly.
Got it. Young and sweet. I got it.
So, now we've
Yeah, so
figured,
now this is an
usually
adult.
this is childhood adolescence. Most people get type 1 diabetes at that age, up to around 17, 16. Although we get some who get it later on in life. Now, after that, now this child, now let's say now this is someone now, again, not with type 1 diabetes. We are just following someone's life journey.
Yeah.
So let's say someone who's 20-something years old has their new job. Yay. They have their new job. They're feeling good. They are driving, you know. Life is good. You order KFC here and there. Nowadays, there are so many apps. Sindio,
Yeah, I'm
walking
guilty.
much. And then they get like 20 kgs weight gain in 1 year.
Yeah.
And then even to diabetes in India. It's not a very dramatic.
Right.
It's not a dramatic entry. It's just what we do regularly. You just gain weight, pole. And that's it. It just comes. So that happens quite a bit. And it's because people are not proactive. I think once people get that proactiveness, and especially those who have a history of type 2 diabetes. By the way, type 2 diabetes has a more genetic link than type 1. Yeah. So that's why you see a lot of families, the father had diabetes, the grandfather had diabetes, the uncle, whatever.
Auntie.
Yes, type 2 diabetes. So if you know it's in your genes, don't wait for it. Like, be proactive. Start working out in your 20s, Nini. Make sure that you keep it off. Keep that weight off as much as possible, or keep fit and active as much as you can. Because you're living a defensive life. Because it will come.
You're like shielding yourself.
It will come. Yes, you need to shield yourself. So that is one of the things that I would say. And then the other thing is now a lady who is in their 20s, also the same, gaining weight, Nini, then gets pregnant. Then during pregnancy gains another 20 kgs. And then after pregnancy takes njahe and what is it people take that uji? Gains another 20 kgs.
Yeah.
Diabetes comes like that.
So like what symptoms now is this adult watching out for?
So this adult should be watching out for increased urination. The symptoms are almost the same. Peeing a lot, like a lot, like in an hour, unaona mtu every 10 minutes ameenda loo. And then eating a lot without feeling full, like you just keep on feeling hungry and feeling thirsty, very thirsty, because they're peeing a lot as well. The reason they're peeing a lot is because the sugar is high, the kidney is trying to help. Like, but wacha nitoe, but it makes you dehydrated. So you take a lot
more
of
water.
Yes. And then the other things to watch out for, blood vision. That sugar ends up in the fluid in the eye. And it makes the fluid
milky white.
Yeah. So they get a lot of blood vision. Actually, many of them.
Babe. I'm saying she's a doctor. She's coming for a job, and I don't know.
She's coming for my job.
No, she should start with striking first. You cannot get the fruits if you don't go through this with us.
Go to the strike fast.
Guys, in solidarity. And if
honorary status,
guys, I accept.
So blurry vision.
Blurry vision. And then the other thing is numbness because of nerve. We'll talk about complications of diabetes, but some of them already experience numbness. And then the famous one for men, erectile dysfunction. And then the other thing to watch out for, usually for women, is genital infections. So they get a lot because of the sugar in the UTIs and candidiasis, itching.
Right.
It's just
and it's
diabetes.
continuous.
And those are signs and symptoms.
Those are signs and
before diabetes.
No,
before
those
you
are diabetes symptoms.
So when you have those quisha,
not quisha. Diabetes is not a life sentence.
Okay, guys, I don't mean
We
quisha.
will not take it to the oncology department.
I don't mean quisha.
We
That
will not
one.
take it to the oncology department. She's just said quisha.
Hey, I just got my honorary badge. Let me keep quiet.
Yeah. So those are symptoms. So if you know you have had any of those symptoms, please just go and get your sugar checked. But majority of the time, diabetes is asymptomatic. You will not have any symptoms. Yeah. So actually, more than 80% of the time, we diagnose people who just were found to have sugar based on they were going to surgery or they just did a checkup, And that's why it's important to do your checkup because if you get it at that point, before you get any of the symptoms or complications, it's better for you.
Oh, that's why you say test regularly.
Testing, we have to be proactive. not reactive.
True. Yeah. So I think from my space, Daktari, as she absorbs all that knowledge on top of the knowledge she already had. Yeah. Was it TikTok? We'll ask her later.
Imagine nakuanga hivyo.
Imagine nakuanga hivyo.
Yeah.
Look at that. Beauty brains, the whole package. Dr. Finney.
Yeah, so I know we had talked kidogo, and I told you about how at my dawa we have these patients, and we realize like I have a lot of patients who come in and they are trying to get their medication refills, and there's no one to remind them in between like their specialist visit. So before they go to Dr. Hilda, they have like a 6-month break where they're like, okay, so where do I get these meds? Even if it's insurance, like where do I get high quality, low cost medication so that my insurance premium runs for the whole year, as opposed to now I'm 6 months in, my insurance is over, and now I have to plug into that diaper money, you know, whatever money I had stored kando. So we have this program called Mzima where we enroll them and then we give them preferential pricing on medication. We give them discounts on the self-monitoring devices. So we've partnered with Roche where we give them now discounts on this glucometer, the strips, so that it's not painful anytime you're buying, so that even for you, you're aware, you're self-monitoring because you need to take better care of your health, and you're like, you're empowering this patient sort of. Give them the diabetic charts, explain to them like why their nutrition should be this way, you know, and even we can talk about that later. And again, have this regular follow-up. So we have like month on month, just calling, checking in. Hey, Lucy, how are you? How are your sugars this past month? Because they keep like a diary where they do like their sugar levels, and they know. They'll tell you, by the way, this week I went to a function, kaharusi, and I did X, Y, Z. They know. So they know. So I feel like it's helped a lot of our patients. We'd love to enroll more patients. In fact, help you guys so that you don't have to worry about that patient, you know, that you have put on a 6 months insulin regimen.
At least someone is taking care of them every single month. And I think you've introduced the aspect of healthcare financing there. Diabetes is actually one of the most expensive diseases to treat. An average person, if you include the cost of the strips and the glucometer and blah blah and the drugs, you can get it to 10,000 per month. And you know, we're living in Kenya where what's the average income?
Imagine.
It's a lot of
not
money.
everybody can afford that.
And then the medications that are available, yes, you can argue that there are medications available in the public sector, like in the hospitals that are there, but it's still expensive for that person. And some of those drugs that you want for the patient are not available then. They're out of stock. So they still have to come back and buy out of pocket. And it's very, unfortunately, NHIF doesn't cover. It only but it can cover like insulin to a certain point. But then those on high doses, so if it's above, most hospitals have an amount that they have set. A cap. So if it goes above the cap, I mean, most people are on, let's say, 50 units of insulin per day, and the vial is 1,000. So by the time 20 days are up, they've run out of it. So they still have to buy out of pocket. It's very expensive. So I really commend you for your program. I think it's something that is very important for patients. And then also it encourages them. Diabetes can be a very lonely disease. So when you have someone who's constantly guiding you and telling you, hey, don't worry, I got you. I think that's
we're here.
Can someone also get like tested for diabetes on?
Yes, so we've partnered with a bunch of lab partners where they can even come to your house, to your office, wherever you are, they can do for you your tests. And in fact, one of the partners, you get a card, a Mzima card, where it gives you a percentage off like the bunch of tests in hypertension and diabetes spectrum. I think it can even cover all the chronic disease management, like the spectrum of diseases under NCDs, non-communicable diseases, all the tests that are covered underneath, you get a certain percentage. 40% off!
Wow! What? 40 is huge! 40 is huge.
So we're really trying, because we said, my dawa, we care.
I love that, and truly you guys.
And we're really trying to see like how best to empower this patient, you know, like take better care of your health, do your tests. So we're trying.
Amazing.
And also not to make these tests, I feel like it's going to the point where people think about these things as optional until it's too late.
Yes.
And to think about it as preventative. Because I think a lot of, as you mentioned earlier, people are coming in, getting an amputation, or coming onto dialysis immediately. And that's when I realized, oh, I have diabetes. But you have all these symptoms, and you don't grab the option and run to the option of preventing and getting yourself if you can get pre-diabetic and remission.
Yes,
talked about remission earlier. I'd love to get into that, because if it's possible for someone to reverse the process, I'd really like to know how that is possible and what steps someone can take for that.
So there are many studies that have been done. You know, initially it used to be like a myth, like, can diabetes really get cured? Actually, by the time I was in med school, I will not mention when this was.
But we're the same age group.
We're the same age group.
It's okay. It's okay. HbA1c.
I went to school early. By the way.
That's the thing.
We had actually.
Even our guest is
We had a guest who told us, before he was born, he started school. Where's man?
Shout out to Al.
So, what was I saying, guys?
So we're talking about
med school.
In med school, the way we were taught was someone gets diabetes. It's a lifelong condition. Give them medication. And that's why you see, and many people still get this kind of treatment out there. Kazi tuni, you go to the doctor says, how are you doing? Prescription,
out.
Prescription, home. But we need to change that, because we are missing out on so many people who have the potential to reverse, especially the ones who are diagnosed within 5 years, the last 5 years. Those ones, it can be reversed at that time. And studies have now been done. And the main thing is, try and lose 20 kgs to these people who are, if they're overweight. Of course, we're talking about type 2. Type 2, not type 1. Type 1 is, there's nothing.
There's no insulin in
but
the body, right?
they're working on pancreas transplants and stuff. But
interesting.
But kuna insulin pump. But insulin pumps are expensive. They're $1 million bob.
And now shillings?
Yeah.
Okay.
So, and then maintenance of like 30 to 50K per month.
You gotta get out of here.
Yeah, it's just
get out of here. What are you talking about?
But in other countries,
this is something that you need.
Is it a car?
There's something like places like Denmark, the government gives that.
Gives them,
Just fall in the wrong place.
Lord,
look at
anyway.
I'm coming back as a Danish. Not
as a Danish. Not as a pastry.
So for type 2, if you are overweight and you have type 2 diabetes, target losing 20% of your body weight or 20 kgs.
In what
span?
In what span? Usually a gradual loss, 6 months to a year.
That's steep.
There are some people who achieve this though through bariatric surgery. So those ones, they lose this even within 3 months. But then the diabetes goes away. So nowadays, it goes away. And you see, this is what you're trying to say. Rather than giving someone drugs worth 10K every month for God knows how many years.
Right.
If you can get them to lose the weight and stop the diabetes forever, why not? So not all of them, of course, will go off diabetes, but around 50% of them through bariatric surgery can reverse and keep it off. But so long as the weight is kept off, 20 kgs or 20% of the weight.
And they have to maintain that.
The problem is maintaining.
The issue is maintaining.
So I've seen a lot of people usually when they see the results, they're happy and then they relax.
Go back,
Now once you relax the lifestyle, now unfortunately that second part, time you might not be as lucky.
So now I'm 10 kgs down, so I have 10 more to go.
Woo!
I've been working, I've been in the gym. So like now I have 10 more to go, and the thing is, you don't even understand how hard that 10 is, that fast. People say that the bigger you are, the easier it is to lose weight, and I have had that a lot. But I think it's also because when you're so used to living a life with particular habits, reversing those habits, even if you're going to the gym, telling yourself, okay, fine, I'm not hungry, I don't need to eat. I don't need to eat all this. I could portion control. I don't need to eat. I could eat the healthier option. Rather, that is the making the habits, the creating of the habits and the sticking to the habits is the hardest thing. And that's why I think people, you just end up going back. You relapse. I think relapse, that's the word. You relapse back into your old habits. So even losing that second 10, I'm constantly telling myself, please, girl. It's not even about the look for me. I was just intent on getting healthier and feeling healthier. This next 10, I'm just looking at it like this. I'm like, do I even need to actually? I love my body the way it is. I love my body the way it is. So I get...
you get what is. And that's what I also tell my patients who are on semaglutide. Because they look at semaglutide as this heaven-sent drug. They lose the weight. But if you haven't changed even balloons, because we also do balloons nowadays. Gastric balloons for weight loss. But once it passes, if you haven't changed your lifestyle, you will get back to where you are. So lifestyle management is the number one thing in diabetes care.
Yes.
All forms of diabetes.
Actually, that's a great segue to talk about Ozempic.
Yep.
Because I don't know if you guys know, but there's a drug that has been spoken about a lot, especially currently now in Hollywood.
Yeah. Drake.
Speaking about it. He was chilling. Drake was chilling. Kendrick has really tried to murder him. I need the man to just, Aubrey,
chill.
Rest, darling. Rest, beloved. So there's Hollywood right now, there's a lot of buzz about Ozempic because people are talking about it very openly. Celebrities are talking about it very openly, their journey of weight loss on it. I believe recently Oprah talked about it as well. Now there's a point she even had to quit. Step down from her position in Weight Watchers because of how she kept on fluctuating in her weight journey. But Ozempic has really helped. So I'd like to bring that conversation now locally and talking about semaglutides, which is I think the larger the umbrella of what Ozempic is. It's just one part of the semaglutide space, right? And weight loss, and people who are utilizing these semaglutides for weight loss. Will it affect your, I'd like to know if first of all, does it work? From what you've seen, does it actually work with the weight loss? People lose the weight, keep the weight off. How much weight do people lose, and how does it affect their insulin, if at all?
So first of all, semaglutide is a hormone called GLP-1 agonist. So GLP-1 is a satiety hormone. So each one of us, by the way, gets GLP-1. When we eat, we feel full. And that fullness hormone, it's because there's something that has communicated to the brain saying,
enough is enough.
So now scientists realize, okay, this hormone is there, but it's broken down very quickly. Within 5 minutes, it's out. So now they're like, we need to find a way of making this hormone stay longer in the body so that you feel full longer. And that's exactly how semaglutide came.
What?
I feel like that's a good thing, though.
Yeah. It is a good thing.
Because me, my GLB-1 12, what is it called again?
GLB-1.
That girl doesn't stay around for long. She's just like 3 minutes later. Do you want to try? Yesterday when you were talking about ice cream, I really thought, ice cream is a quas right now. But I tell myself, do you really want ice cream right now, young lady?
Yeah, mine is non-existent. Just
I didn't know. That's so interesting.
So that's what semaglutide is. It just makes the satiety hormone stay for longer. And then it reduces the transit time of food in your intestines. So the food stays in the stomach for longer. The brain thinks it's fuller for longer. So it's a whole positive thing, which ends up with you taking less. Just think of it as a balloon, but chemical. A hormonal balloon.
So all it does is reduce your hunger and then increase the amount of time maybe the food takes to go through your system. So it's not that it increases your metabolism.
Nothing,
That's so interesting. Because maybe it breaks down the food faster. That's why people lose, or it breaks down the sugars in your system or the fats in your system faster. That's why.
It's only because you eat
very
less.
interesting.
That's
okay, got it.
So initially it was made to be a diabetes drug. Right. But then when they realized that there was a lot of weight loss associated with it, of course.
Like,
you remember the Viagra story?
Exactly.
I want some of that.
Yeah.
Give some of that.
So, of course, the weight loss now came in and took over.
Right.
The doses for weight loss are higher than the doses for diabetes. Diabetes doses are usually probably up to 1, just to manage the sugar. So one of the things is that it manages sugar levels because, of course, you're eating less. And so it makes the sugars more stable. 0.25, 0.5, those are really good doses for someone with diabetes. But for someone who needs weight loss, we go all the way up. And that's why we now have something called Wegovy. You've heard of Wegovy?
No,
Wegovy is now Ozempic, but on a higher dose. So Ozempic goes up to 1 milligram. Wegovy takes over 1.7 and 2.4, manufactured by another company. And then there's something else called Mounjaro that came into the
Mounjaro. It sounds so Luya. It sounds very Luya.
That's a very local one. Ingoho Mounjaro together.
So Mounjaro has it takes care of 2 satiety hormones. Remember, this one was taking care of GLP-1. Mounjaro does GIP and GLP. So it takes care of 2 intestinal satiety hormones. GIP is still the same as GLP, but it's just another hormone.
Also, there are multiple satiety
So now it's
hormones.
like potentiating the effects. So people on Mounjaro...
Doctor potentiating?
Yeah.
Come correct.
But we say...
Vinny will recap for us.
You recap for us.
I got you guys.
So Mounjaro causes more weight loss than even Ozempic.
Interesting.
Yeah. So all these things, all these drugs are coming into the space. Although the truth is that we are making it into a multi-billion-dollar industry. When the truth is, it just needs someone to be just more careful about what they eat. We don't need to be spending all this money doing all this stuff. If you can do it by just changing your lifestyle gradually, the better.
And does it affect someone's sugar? Like if I come in and I don't have any insulin problems, I don't have like my body, despite even being overweight.
No. It does not bring your sugar down.
Okay.
It will just make it. It only helps when you have high sugar. But when you don't have diabetes, we still give you the drug with no effect.
That is actually really interesting.
Yeah.
Okay, and so do we have semaglutides available in Kenya?
We do. We have some generics.
Okay.
So of course, the patent is there. But who are Indians?
But of course.
I wasn't
looking at you. Oh my God.
We're not looking at anybody.
Looking at him.
There's no.
You didn't
So now they've been made into. They have different versions.
Yes. So there are generic versions available, which are much cheaper. You know, like in Ozempic, they're like how many? Like probably 70, 100,000 shillings.
50, 150.
Per pen, even.
For a pen. And then the generics you get for like 35K.
So what do you mean for a pen? Like for a dose?
Yeah.
Like a pen, you know, like
what do you mean?
A dose, a month's dose is in a pen. I wish ningekuja nayo. Ni kama insulin pen. Have you seen an insulin pen?
No, I think what I'm thinking about right now when someone says insulin pen, when you say insulin pen, is the pen for
EpiPen.
That's what I'm thinking of, the EpiPen.
No, alafu movies usually make it look so dramatic.
Yeah, it's
anyway. Through the clothes.
Through the clothes, surely. How? And yet it's probably through here even.
Okay.
Seriously.
It's really interesting to know. I think, because I'd be curious about it during this weight loss journey that I'm on. I think I was worried about the whole, how it affects your, because I don't want something that ends up affecting my sugar.
Yeah.
But something I'd love to do for this episode is actually get my blood sugar, my
HbA1c.
I would love to get that.
Please do it.
For this
Talking
episode,
about
actually.
that.
Yeah.
You know, I did mine. Like I told you earlier on, I have pre-diabetes.
Right.
Yes. Or I had. I'm not.
Please. Do not own it. Please.
Yeah, so I have polycystic ovarian syndrome, which you remember I told you there are other reasons to get diabetes, which are, so PCOS is one of them, which can happen when you're either skinny or big, doesn't matter. And that insulin resistance causes type 2 diabetes in a lot of people with PCOS. So my HbA1c was 5.9%. You can imagine the shock on my face. I knew I was predisposed, but I still was shocked. So I would encourage everyone, because I look smaller, so no one would even think who you are as a pre-diabetes. So let's not look at size. Like, do your tests.
For the layman and woman in the background, I think just remind us about the complications for diabetes and what we should watch out for, especially for our patients.
So we usually group them into two main ones. There's microvascular and macrovascular. That just means the complications affecting the small vessels and complications affecting big vessels.
Okay.
So macrovascular is big vessels. Which
Veins,
big vessels?
Veins.
Mostly arteries.
Arteries.
Yeah. So arteries going to the brain.
Wow.
Arteries going to the, where else?
The legs.
Legs. And where else? A big place.
I'm on the chest.
Yeah.
It's wrong, guys.
So
I'm in the wrong profession.
Very good. So 3 main. So stroke, leg ulcers, etc. That's why they get amputations, chronic ulcers, and then heart attacks. Yeah. So those are the 3 main macrovascular. Then microvascular, small vessels.
Capillaries.
Hey!
Am I right or wrong, guys? Doctor.
Small vessels. Good job.
Did you go to med school? You know,
guys, I was so good in biology, honestly.
You got to med school between the last episode and this one. She really did. This is so suspicious.
No, I had a session with her.
I'm the only
guys,
doctor
we didn't tell you.
We're
sorry, we had a session.
I'm the layman you were talking about earlier. It's me.
So microvascular, small vessels, those are eyes. Okay. That's why we tell people with diabetes to go annually, every year for checkups, even if they're seeing properly. So eyes, then kidneys are small vessels, and then the other small vessel is nerves, neuropathy.
Is that why, some people who get diabetes end up blind?
Yeah.
Yes.
Okay.
That's exactly why.
Okay.
That's why we do annual screening for people with diabetes, even if they are seeing properly. And then last but not least, because men will not forgive me if I don't say this, is the penis.
Yes.
Yeah.
Is it a micro or macro?
Cut it out. Cut that one out.
Okay.
Yeah.
That's not funny?
No, it is. I'm just saying.
It's hilarious.
We love men.
We love
we
you,
are pro
sweetie.
men.
We don't. Yeah, we want all the best for you and your peers.
So the thing about complications, though, is that they can be prevented by, again, proactive. You see the way in Kenya we wait for floods before we realize, oh, drainages were blocked.
Thank you.
Did the government is catching just trees on this episode?
Yeah, kabisa.
Yeah.
Drainage system should be working so that even if it floods so much, bado tuko sawa. So the thing is, we've talked about macro. So stroke, heart, and legs. We have to do screening of the legs. Checking the blood flow to the legs should be done annually by the doctor. It can be done by an ultrasound or even just by physical examination to make sure that the pulse is being felt in the legs. Then when it comes to the heart, ECGs, you know, ECG, echo, looking at the heart to make sure it's fine. It should be done at least once. At least, but it can be done more frequently. Then for the brain, there's nothing much you can do, but there's another ultrasound that can be done for the arteries leading to the brain. It's called a carotid Doppler. And then that can tell us whether you even knew the carotid.
Guys, I'm on a roll.
So carotid ultrasounds need to be done as well to see whether there's any blockage here. So we are being proactive. You look for them before it happens. Yeah. Then for the microvascular, for the kidneys, because that's the #1 complications in Kenya. And by the way, Africans are more prone, for black Africans that is, are more prone to kidney disease than strokes. White people are more prone to strokes
than kidney disease.
Yeah.
Really? Okay.
Why is that?
Genetics.
Okay.
So kidney tests should be done, but on top of the routine kidney test, a urine test should also be done to check for how much protein is leaking through the kidney. Before anyone who is on dialysis now, it started by just simple protein leaking from the kidney. Just a simple thing like that. If it was found out 10 years ago or 8 years ago, the transplant or the dialysis could have been avoided.
Yeah.
So what I'm saying is still proactiveness, just proactiveness. So urine test is a must, eye test annually.
Yeah.
And then the doctor, if there's a problem, you go according to how many times. And then for nerves, treat the nerves accordingly because usually it comes with symptoms. So that's how to prevent complications. Yeah. So be proactive and go for screenings.
Yeah, and then I think again another thing is for the caretakers,
Yes.
telling them like footwear, you know, like proper footwear, because you know they're numb, like they're not feeling,
they don't feel
sensation, or like if it's too cold, then they get numb, so they don't realize when they step on a sharp object, they have a wound and they don't realize it. It gets infected, get gangrene. You're wondering, your foot is being amputated,
and they don't even feel pain. They're like, they don't feel anything.
You know, another one told me. They were otaing moto, like there was
that's common.
there was the bonfire, and they didn't realize they got burnt.
What?
Imagine.
Because the nerves are, you know, that's why your nerves are there. The pain is a defensive mechanism. It's supposed to tell you, stop, run away. But
So
if you don't have that,
just lose sensation.
Goodness.
That's the interesting thing. Sometimes you think that the worst thing that can happen with maybe like, let's say, diabetes is dialysis, but there's so many other complications that can happen that, you know, could lead you down maybe even a harder path for you, depending maybe on your life or your lifestyle. So to prevent all this and to be able to get someone to a place of health, and, you know, health is wealth. Indeed. What would you say are the solutions that someone could embody and live in, especially from a lifestyle, maybe dietary perspective?
Okay.
Yeah.
So let me start from the beginning. So type 1, we've said there's nothing we can do.
Yeah.
But now we're talking about type 2 diabetes.
Yes.
All about insulin resistance. Number 1, know your risk. There are actually risk calculators online. You can just type and it will bring something that can calculate your risk for diabetes. If you find yourself at high risk and above, please just start living a proactive life. Less carbs, more vegetables, more exercise. You know, it doesn't matter your age. Because that is usually based on your BMI and your family history. So if it's high, just start changing your lifestyle immediately.
Okay.
Now, when we talk about lifestyle, we're talking about exercise and diet. Those are the two main components. Exercise, even for people with diabetes, we say exercise 30 minutes a day, 5 times a week.
You know what I love about that?
Yeah.
So manageable. We're talking earlier about how when people think about exercise, it's 1.5 hours in the gym doing HIIT, and you go, my arms are confident. Sometimes it's walking on a treadmill at 4 speed and maybe 2 incline for 30 minutes and that's it.
Yes.
It doesn't have to be anything
too grand.
Sorry to interrupt, but
that is true.
Yeah,
and even because I have
older
patients, a lot of them in their 60s and stuff. So I usually just tell them to go around their shamba.
Exactly.
You don't have to walk around your shamba for 30 minutes. And so it's important to just incorporate it. Let it be part of the lifestyle. And then what I encourage people is don't do something that you know you will not sustain. So if you know that you travel a lot, why are you enrolling in a gym? And then you're there 1 week in a month. Create a lifestyle where you go, depending on which hotel you're living in.
She feels attacked.
First of all,
she's not eating her greens. Daktari!
By the way.
We'll talk
I think,
we'll talk offline.
She thinks that if she wears greens.
She said.
If you eat green, that means inside your greens, right? To wear green,
So make it part of your lifestyle and manageable. Then, for those who are not able to, like people who have been amputated, there are people who can't, or those with bad neuropathy, there are exercise physiologists nowadays. So people who can actually assess you and give you an exercise plan even with your complications. Yes.
That's very nice.
Yes. I actually, at my clinic, I work with an exercise physiologist and she's amazing.
Wow, that's very nice.
Well, give us her contact.
I'll give you her contact.
Yes, please.
So that's one. Now, when we come to diet, there are so many types of diets. I've been told about which one from South Africa for 90,000, where you take for 3 months. There are so many diets that my patients have been doing until I'm like, okay. The truth is, there's no such thing as diabetic diet. Diet is just cooler, low-carb diet, cooler, balanced diet, and eat what you have around you. If you're in the village, do your skuma wiki, eat your ugali from the posho meal. It doesn't have to be something so out of this world. So whatever you have, the main thing is low carb. That's what I just want you to take home. For some people, keto works for them. For some. Not all people. Like for those who are still insulin dependent, doing keto might be bad because their body still needs
the sugars.
But then for some people, keto has done a good job and they lose a lot of weight through keto. And I'm not saying it's bad, so you can still do it, but do it under the guidance of a nutritionist and a dietitian. They are available, they'll give you a diet plan. It is not that expensive. With 5,000, you have a diet plan that you can use for the rest of your life. And yet with 5,000, you can just go and do random things in town, So you'd rather invest in something that you can use forever. So get a diet plan, get a diet that works for you, and then be sustainable. And then stay away from fads. By fads, I mean these things for you 3 months of this, 2 months of that. It's not sustainable. You won't be consistent. So I've had patients who've lost a lot of weight and then they gain it back because no consistency. So if you maintain that consistency, seek the services of a nutritionist to guide you to make sure you have enough essential nutrients, then you're good to go. Now, for those who already have diabetes, for those with pre-diabetes, we already talked about weight loss and how you can get rid of the diabetes. For those who have diabetes, get your medications and stick to them and get followed up. The problem with diabetes is sometimes the patients feel like they can manage themselves. So you find someone who's not even been to clinic for 5 years. Mimi daktari nilienda nikanunua tu kwa chemist. That is so common. And then now they come with complications. So it's important for them to be followed up, do the HbA1c regularly to make sure it's within normal, because complications come because of high sugars. So if you maintain them low, the complications will be fine. So even if you have diabetes, it's not a death sentence. Life moves on. You just manage yourself, manage your diet and your exercise pattern, and you'll be good. For those who can get bariatric surgery, for those who are maybe very overweight or obese, you can get bariatric surgery. If you have access to it, by all means, go for it. I think it's something that we can use to actually treat diabetes. And for some people, it can go or reduce. I had a patient who had been using, maybe one day you can even interview her as a patient, I don't know. She said she's willing, but she was 120 kgs. She was on 150 units of insulin per day.
She was diabetic?
She was diabetic. After bariatric surgery, we went down to 10 units within a week.
What do you mean?
A week.
From 150 to 10?
1 week, yes, from 150 to 10. And I kid you not, up to now, she's now on orals only. She's not
My
on
goodness.
And this is someone
Those
who has
are
been using
real life
150
testimonies. That's
units.
crazy.
Yeah. So it's something that we need to embrace more. And I hope with time, as more light is shed, this will be seen. For those who are using drugs like semaglutide, Ozempic, and the rest, remember it is a means to an end, but it is helping you, but lifestyle change is still the most important thing. Yeah.
It's been a really fantastic conversation.
been.
Thank you so much for being here.
So, Dr. Hilda, I have an interesting question for you to start with. How many pairs of socks with holes do you have in your closet?
You can't even show us these ones, by the way, we confirm.
Hey, don't do a daddy like that.
Actually, when they get holes, I throw them away.
Oh, my coffee.
Actually, well done, because so do I. Actually,
You too?
My real question was for the person who asked this question.
Exactly.
What is going on in
What
their
is
head?
going on in their head?
Can I ask that person that?
Yes.
We'll ask them.
We will actually
We're
ask
going to send
them.
them a text
We
just
invite
now.
them back.
We will invite them
Text
back.
them, written.
We'll invite them back and ask them, how did you,
What's
because we
again?
told him, please ask the next guest something like, you know.
Yeah, and
So
that is
now
what
I
he
need to
decided
also
on.
ask something.
Yeah, no,
Yes.
that's
Yeah,
a question for
our next guest.
Let me say, is it serious or fun?
Whatever you
Whatever you want,
want. Even if
whatever you
want to
feel.
dare them.
Oh, okay.
Whatever you want.
Ah, no, I don't want to dare them. Okay, mine is boring. Guy, can I think about it?
You can give them a day, you can ask a
Let
question.
them do for us push
You
ups.
can think about it for like 5 minutes.
Can they dance?
Until cut.
We
That
have
will
a
be so nice.
We even have a. We have.
Oh,
a,
yes!
we have a
That's the thing. I want them to dance
Yes.
for 20 seconds. Apa, katika. Yes.
You know what? Yeah, we love you. Yeah, we love you.
No, you know what? Challenge accepted.
Yeah.
I really hope they can
And I need
dance.
to be, it has to be to my satisfaction.
You might make them come back and do it again if you don't like the way they do it.
Yeah.
Guys, what an episode. I mean,
Yeah.
eh?
Yeah.
I've also changied a lot.
Oh, you're a doctor.
I'm a doctor, please. My
Look at you adjusting your stethoscope.
Let me even show you guys. And Dr. Thank you so much for gracing us. We've learned so much. We've had so much. Dr. And yeah,
I've learned.
even you've learned,
Yeah,
huh?
I've learned so much today.
Which is good. So thank you so much, guys. Remember to follow us on all our socials at MyDawa and on YouTube, My Health, My Way. We have been your hosts. I'm Finin Degwa.
I'm Dushikuria.
And I'm Dr. Samira.
8 out down. Mwah.